Good evening and happy St. Patrick's Day. As the grandson of Leona Cunningham Kelly and someone who studied at Dublin City University in Ireland, I will not miss the opportunity to celebrate St. Patrick's Day, if only at home with my wife and two children. I want to thank Select Board Chair Green, the other Select Board members, and Town Administrator Mel Kleckner for inviting me this evening to give an update on what the state is doing in conjunction with the town with respect to COVID-19. I want to also thank Brookline Interactive Group for helping make this possible. I am recording earlier today at the big studio all by myself. Corbin is in the control room, and I am here again by myself, trying to make sure that we are containing this virus the best that we can. I also want to thank the governor, Speaker DeLeo, and Senate President Spilka for all of their efforts. Know that state government is working really hard on many different facets to try to respond to this as quickly and effectively as possible. And so I want to get into those quickly. First, I want to talk about what the state is doing. I almost touched my face there. I'm trying really hard not to, as we all should. I want to talk about what the state is doing for those who are already sick. The state has canceled all elective non-essential surgeries to try to preserve room in the medical system for the growing need around COVID-19. We are expediting the processing of reciprocal nursing license applications for nurses licensed in other states. Hospitals and medical systems are ramping up, making sure that they have capacity when the number of sick get higher. And all insurers are required to cover telemedicine related to COVID-19 without copay or coinsurance. That includes both testing and treatment. Mass Health has expanded home visit coverage. And again, Mass Health is paying for testing. And so if you are sick or believe you are sick, please call a doctor immediately and talk with your insurer. You should be fully covered. Money should not be a barrier to you getting tested or getting treatment. What is the state doing to help people not get infected? There's actually quite a long list. As you may already know, all public and private K-12 schools are closed all the way through Monday, April 6th. The only exception are schools for special education students, both boarding, residential schools, and day schools. Nobody's going to school, but that doesn't mean you don't study at home. In fact, the governor has made it clear that local school districts are to work with families to ensure that curriculum is happening at home. The details are still up in the air, but we want to make sure that our young people continue to learn, continue to have a sense of normalcy. My son worked on his times tables today, and he and I are going to compete tomorrow in some flashcard madness. It's our substitute for March Madness. Restaurants are limited to takeout and delivery. That's statewide. You cannot go sit down in a restaurant, but you can pick it up to go. Statewide, gatherings are limited to 25 people or fewer. That's both indoor and outdoor in a confined space. That includes religious, commercial, social settings. You may not gather in groups in excess of 25. Of course, in the town of Brookline, that limit is 10. Elsewhere in the state, it is 25. Assisted living and hospital facilities have extreme restrictions on visitation. If you are intending on visiting someone in a nursing home or assisted living facility or in a hospital, I encourage you to call ahead. You may not be eligible to visit. And of course, that's to try to prevent the spread amongst the most vulnerable populations. MBTA has reduced hours. Essentially, they're operating on Saturday schedules. And the State House is closed to visitors. Only essential personnel from the executive branch and the legislative branch are permitted in at the time. The state has done some things to provide support for people who are impacted but not infected. That includes the Department of Public Utilities has a moratorium on all gas and electric utility shutoffs until further notice. The RMV has extended renewal times by 60 days in almost all cases. Again, call and confirm. The state has lessened requirements and expanded access to unemployment assistance. There are some details there. I don't want to get burdened by the details now, but know that if you are currently collecting unemployment or have already applied for unemployment, please call and confirm. You may be able to get it faster and have reduced requirements before you get it. So go ahead and make that call. Unemployment benefits are available now to a worker who is quarantined or who leaves work out of fear of exposure. And there is care for family members without medical documentation. Finally, things that have already happened, there is a $10 million small business loan appropriation already available. The loans are up to $75,000, no interest or payments for no payments for 6 months. I'm not certain on the interest. Check that out. I recognize none of these things are exactly the right thing for everybody, but to the extent that these are useful to you, your business, your family, I encourage you to look into them. There are also a number of things that the state is actively considering or pursuing but hasn't implemented yet, perhaps because consensus hasn't been found, perhaps because the final language hasn't been written down. These are some things that we're working on. None of the things I'm about to say are certain to happen, so please don't make decisions assuming these are certain. This intent here is really just to let you know that these are some other things that are being worked on. And if you have advice or opinions or thought, please reach out to me. I'll say it now. I'll try to remember to say it later. Tommy.Vitolo@mahouse.gov. And my phone number is 617-872-8921. It is my cell phone. Call 24 hours a day. I promise if I'm sleeping, I just won't answer, but I will get back to you. Some things that we haven't done, but could yet do specifically to help those who are infected. There's a conversation around allowing people with recently expired medical licenses to return to work. So for example, if a registered nurse retired on December 31st, 2019, he or she might be available to come back and help out. There's conversation about how to create additional hospital beds that could be in existing medical facilities or in, frankly, facilities that aren't currently medical facilities. And there's conversations about dedicating certain hospitals to only work on treating COVID-19. All of these are very preliminary. They're conversations. Again, if you have ideas or suggestions, don't be shy. Some things that we can do, the state may do further to reduce the spread. I have filed a bill, I filed it this afternoon, that would give executive branch of local government, that is mayors and select boards, the authority to further alter the operations, hours, and indeed perhaps closures of other businesses. We're already seeing in Northern California, almost a dozen counties are on lockdown, and we expect that we haven't seen the end of the closures. Looking at France and Italy and Spain, looking at what we've seen in other parts of the country, I believe that we will see more restrictions before things ease up, and I think that that's important. And so my goal is to make sure that municipal government has the tools to do what the public health experts are recommending. That's why I filed that bill. There's more to come on it. It certainly isn't law yet, but stay tuned. Additionally, as I've said, there have been stay-at-home orders in Northern California. We may see that here. My hope is that we can do as much as is necessary to really protect public health. Additionally, some conversations around additional support for people who are not infected. There is legislation filed to stop evictions during the crisis. Again, it's not signed into law, it's a conversation. Similarly, to eliminate the 1-week waiting period for unemployment benefits. And finally, to establish a grant fund to support those who are quarantined or impacted by COVID-19. I have co-sponsored all three of these bills. I won't swear that the language is perfect yet. There is still a legislative process. It will be a fast one, I hope. But I think these are all movement in the right direction. Finally, the state has made some action and is considering actions regarding municipal government operations. So I want to highlight those before you, the select board, tonight. As you know, the open meeting law has been relaxed to allow meetings to take place online and remotely without a quorum in person. That's how this meeting is taking place. That's how other meetings in Brookline have taken place. For viewers online at home, know that this isn't so easy to just drop into place. It's not as simple as a WebEx meeting in your office with 3 people. And so I ask that you have patience with town staff and with town administrator and select board members, school committee members, advisory committee, all of these boards and committees who are trying their best to both do the public business using a new form with a new culture and under the time stress that's coming. So please have some patience. And if you are staff, if you are a chairperson of a committee, please keep working on this. It's really important that we push forward with the town's business, and it's important that we do it in as open a fashion as possible. So please stick with it. Regarding elections, some elections have already been postponed. There was a local election in Wellesley that was to happen today. It did not. My understanding is a court order delayed it, but I'm not certain on the details. I just know that it didn't happen today. I want to add also that Secretary Galvin, the Secretary of the Commonwealth, has announced that anyone may vote absentee using COVID-19 as an appropriate medical reason. We don't have no excuse absentee voting in Massachusetts as a matter of law, but self-quarantine and social distancing do count as a medical reason to vote absentee. And so anyone who's voting in an election in Massachusetts should feel free to vote absentee. And in fact, I would encourage that. Furthermore, you can apply online, but if you do not have the application and you want to just mail in the appropriate information to the Secretary of the Commonwealth or your town clerk, you can do that as well. Please go to the website and get the details. Super important. It is my preference that we do not delay elections, that rather we switch to an all absentee ballot system. But this is ultimately a decision of the full members of the House and the Senate, just like all other laws. And so we don't yet know what will happen. I look forward to feedback from the Select Board and others on what folks think Massachusetts and indeed Brookline should do on the matter. Finally, with respect to town meeting, there is several pieces of legislation in various forms of draft. The House and Senate are working with the Moderators Association. In fact, we have a rep, David Vieira, who is a moderator in his town. And so we're working through the detailed and specific challenges related to holding a town meeting. And that includes allowing for 30-day extensions of town meeting, permitting select boards to postpone town meeting beyond June 30th, permitting the adoption of lower quorum rules, permitting month-to-month spending in FY21 based on prior fiscal year with no budget, permitting towns to access their free cash balance for FY21, and authorizing a 3-year amortization period for deficit spending incurred as a result of COVID-19. Again, none of the things I just said are law just yet, and I would discourage you, the Select Board, from making decisions relying on this being law, but know that we are trying very hard to accomplish this while at the same time working hard to help heal those who are already sick and help prevent others from getting sick and providing economic and other supports for everyone involved. There's a lot going on at the same time. We're working very hard, and it's very important that you, members of the Select Board, Town Administrator, please feel free to call me, reach out anytime. I'm here to help you in any way I can. 617-872-8921. Folks watching at home, same thing. If there's something I can do for you, please don't hesitate to call 617-872-8921. And you can bet I'll do everything I can to help you out. I'm happy to answer some questions. The plan is to do that via telephone, so I hope at this point we will click over to my voice, but not my face. Thanks very much for this time, and I look forward to working with you.